So ketamine can be administered in several different ways. Practically, there are 4 to 5 different ways that ketamine is administered clinically these days. Ketamine can be administered as an IV, usually as an IV infusion. It can be also administered as an intramuscular or IM shot. Can also be administered as a sublingual lozenge. Terms like troche or oral dissolving tablet are also used, which are slightly different, but in general these absorb through the mouth. And then it's also used as a nasal spray. Now I say 4 to 5 because what is the 5th one? Some clinics are also using subcutaneous injection instead of intramuscular, which has a little bit different properties as far as absorption. Now, that's a lot of different options. What does that mean to you? Well, 3 of these, the subcutaneous, the intramuscular, and the IV, these are ones that need to be done in a monitored setting, usually in a clinic, but there are also some services which offer in-home access to this. The intranasal spray and the lozenge can be prescribed to you, can also be done in a clinic, and these are often accompanied, but not always, by therapy. So what do we know about the differences between these? Well, describing what it feels like is usually done through a graph to tell you what the intensity looks like over time. Now, here we see the IV infusion, and you can see that it's just a slow, steady ramp up of intensity as you move through the infusion. That's like an escalator. Maybe you can think about it like one of those moving walkways at the airport. It's going to bring you up slow and steady. Now you see what the profile of the intramuscular shot, the IM shot. You can see it's a rapid increase, so it's kind of like rapidly whisking you away from your normal state of consciousness. And this usually, the whole arc, slightly shorter, but around about the same amount of time as the IV infusion. The subcutaneous is a little bit slower absorption and a little bit longer route than the intramuscular shot. Now, when we use the intranasal spray or the sublingual lozenge, the reason why these are used less often and are used as a prescription is because these are not as bioavailable as the other routes, meaning that more of the substance is lost from administration to getting into your body. The lozenge is probably the most variable. You put the lozenge in your mouth, you hold it in your mouth for about 10-15 minutes. The ketamine absorbs through the skin in your mouth into your bloodstream. This is affected by many factors, by what you've eaten recently, by how much saliva you have, by how hydrated you are. So it's a technique-dependent administration, and this is why it has so much variability. Same thing for the nasal spray. You can imagine if you've ever used Afrin or any nasal saline to clean out your nose, sometimes it goes way back and you end up swallowing it. Sometimes it seems like it goes up and then it comes right back down. Same thing for trying to administer ketamine in that way. The technique gives a lot of variability in how much gets absorbed. So these routes are a little bit more variable, a little bit less standard, whereas we have the injectable or the IV routes that have a little bit more consistency each time. So the IV route that is most studied is a 40-minute infusion, and usually in clinical terms we use a milligram per kilogram. So somebody might receive 0.5 milligrams per kilogram body weight of the ketamine over 40 minutes. The nice thing about the IV is that if the experience becomes very intense for someone, if it becomes overwhelming, the IV can be stopped. We can't take out medication that's already gone in. We can't take the substance out of your bloodstream, but we can stop further substance going in, and that's one of the advantages of the IV formulation versus all of the others, because once it's put in the other routes, it's going to run its course. The IV is the gold standard for bioavailability, so we use that as the marker versus the other one. So it's by definition 100% bioavailable when we give it through the IV. The intramuscular shot and the subcutaneous shots are thought to be 95 to 97% bioavailable, so quite similar to the IV route. The sublingual route of administration, either through a troche, oral dissolving tablet, or a lozenge, this has a lot of variability and has been quoted anywhere from 25 to 50% bioavailable. The intranasal route has a lot of variability as well, has been quoted anywhere from 30% to 60% bioavailable. One space where there is a lot of research going on is how ketamine is metabolized in your system. When it goes in through the oral route, which is pretty much the only way to do that is with the lozenge, it is metabolized first by the liver, and this generates this chemical called 5-hydroxynorketamine. This is a substance that there's a lot of research going on right now, and this substance itself seems to have a lot of antidepressant effects. So it's in animal research stages right now, but we may find out in the future that the lozenge route might be advantageous for certain subsets of people because of the fact that most of what it is metabolized to is this other substance which seems to have like strong antidepressant effects. So that's one space to keep an eye on. There's needs to be more research done in that area. In general, right now, with where we are in the knowledge base, we don't have anything that says an IM shot is better than an IV infusion. We don't have anything that says that a certain amount of lozenge-based therapy is superior or inferior to IV. So this is an area where we think in the future we're going to have a lot more information. Right now, though, the best idea that we have, the best way to move forward on this that we have is using your judgment. You are the expert at the experience of being you, and I believe that your internal healer, your inner healing intelligence, has an idea about which pathway is best to go. And I see my position as being there to give you all the information, to be able to give you an idea about what each of these routes feel like, and together we make a decision on which route to proceed. You've just heard a lot of numbers and a lot of analytical, a lot of science-based thought and words about what is the difference between these three routes of administration. But what does the little kid inside you feel when you experience these? Like, what is the felt sense of the experience like? Well, the IV infusion, you could think of it like drifting off, like slowly riding away on this escalator. It's a very gentle experience, very, very yin-like experience, very kind of slow and relaxing. And you have an IV in place. So there's a subtle part of you that feels connected, connected to the pump, connected to the room, and has this feeling of not being entirely free to move the body. With the shot, the peak of the experience is 10 or slightly more than 10 minutes after the shot. This is quite an abrupt shift in your state of consciousness. And so I have heard from patients, using their words, heard this described as a trapdoor that falls out, a rocket ship that takes you away, a cannonball that shoots you out into outer space. Definitely a more abrupt experience, and we're going to talk in a later video about how we think that the difference between these two routes can feel in your body and ways that each can be quite healing for you.